Good evening, everybody, and welcome to our latest webinar on the COVID-19 vaccination program in community pharmacy. I'm Alan Riley, Head of Information and Technology with the IPU. There's not going to be a huge amount of IT in this presentation. What we will be talking about HSE PharmaVax a bit later. Joining me this evening is Claire Fitzell, who will be covering operational guidance for the Comirnaty Pfizer BioNTech vaccine, which is the main focus of tonight's webinar. Also joining us this evening is Kathy Marr, the newly appointed chair of the IPU's PCC, and Nicola Cantwell will be joining us, or should be joining us later, to go through some practical steps for the Commonality vaccine. So next slide, please, Claire. Before I hand over to Claire, I'm just going to go through some housekeeping here. So down the bottom right, you should see a questions box. If you pop your question in there, we'll see them coming up, and we'll try to get to all of those at the end of this presentation. If we don't get to answer all your questions this evening, we will be updating our FAQ, and it'll be on our website tomorrow. We're also recording this presentation, so there'll be a video of it up on our website tomorrow along with these slides. So don't worry about taking notes, because we'll put these slides up there tomorrow. As I said, Claire is going to cover the operational guidance for the Commonality. I'm going to then talk about the PharmaVax system, putting in your vaccine delivery information in there and recording the vaccines as well. And whatever support that you might need from the HSE, we'll cover that too. And then we will be covering some practical advice on the actual Comirnaty vaccine itself. And hopefully we'll have time for questions and answers at the end. Claire, over to you if you want to cover the learning outcomes.
Hi everyone, nice to see you on a nice evening. Quickly, just in terms of what you'll get out of this webinar, hopefully this will only be about 45 minutes long. We'll keep you for as little time as possible, but as much time as needed to answer all your queries. Just because a lot of this is a repeat of some of the stuff that you've known before. So in this webinar, we've pulled out what is different about this vaccine over previous vaccines we've talked about. So the first bit and the first objective is to identify the key operational guidance for the use of the Comirnaty vaccine. And of course, this vaccine has a dilution. So we're going to identify how to input vaccine and diluent batch information into the Pharma Facts system. Alan will go through that. Recognise how to use the HSE PharmaVax system to record the vaccination event for this vaccine, because it's slightly different because of the dilution step and the need to record the diluent. We're also going to go through the key support documents, and I'm going to walk you through our website just so you know where everything's kept. There are some additional bits of information that you need to keep with this vaccine and dilution records, and I just want to make sure you're all up to date as to where to find them on our website. And then finally, Alan mentioned, Nicola is going to come on and give us some practical steps and tips of how to manage this to ensure a smooth running in your vaccinating clinic. Nicola would have trained up the technicians who are currently working in the Carlow Vaccination Centre, so she's got some great information as to just things, practical ideas of what to look out for when you're diluting this vaccine. But before I start into the operational guidance, I'm going to just introduce Kathy Meyer, who's going to talk over the vaccination programme and give you some statistics of where we are at the moment. So over to you, Kathy.
Great, thank you, Claire. I suppose we can see where the Janssen vaccine programme is to date. We've almost 700 pharmacies registered on HSE PharmaVax, and we know that there are some pharmacies yet to register and are planning the first clinic this week. Almost 5,800 vaccines delivered by pharmacists in just over 10 days, which is fantastic. And then with the Pfizer BioNTech vaccination programme, we've 350 pharmacies selected, as you know, to deliver the Pfizer vaccine. As part of PCC, as the current chair of PCC, I will then be joining the HSE meetings, the COVID weekly meetings. So we're continuing to push to see can we get the number of pharmacies selected for Pfizer vaccine increased. And the HSE are updating the website with the list of pharmacies involved in this programme over the coming weeks. Thank you, Claire.
Thanks, Kathy. So great news to see all those people who wouldn't potentially have been vaccinated. So we are vaccinating that vulnerable cohort, and it's good to see that we are out there, you know, at the coalface providing vaccines to people who wouldn't or haven't presented at vaccination clinics. So well done to everyone who's doing that. And I realise that on this webinar tonight, we might have some pharmacists who will be delivering the Pfizer vaccine but haven't delivered the Janssen vaccination programme. You may not have therefore logged on to previous webinars, and I know Alan will talk about Pharma Facts and some of the specifics around the Pfizer BioNTech vaccine, the Comirnaty vaccine. But if you need additional advice, I would recommend you watch some of the prior webinars where we go into the Pharma Facts system in detail. Given that most people will be providing both, we're going to be focusing more on what is different about this vaccine over the previous vaccine, the Janssen vaccine. So the presentation broken into two parts in the part that I'll be delivering. So the first part is on the operational guidance, and that's the HSE guidance. And again, that can be found on our website, and I'll talk you through where to find that guidance. The bits I'm going to touch on are the patient journey and how it's different to the Janssen vaccine, the cohort and contingency lists, consumables, again, they're slightly different than Janssen, and the reconstitution record. I just want to make sure that I'm touching on the points that would be different to what would be included in the Janssen COVID-19 vaccination programme by the HSE. Thankfully, your colleagues have been inundating me with lots of phone calls and lots of questions. So I've got a majority of the questions answered at this stage. So I'm going to talk through any questions as we come up to them. And at the end, if there's any questions in the chat box, I'll do my best to cover them off. And Alan said, just continue typing them in. And if I can't answer them today, I'll get an answer and update an FAQ document. We're in the process of putting that FAQ document on our website for this particular vaccine, and I will add to that as we get more questions and we require more answers. So first off, the patient journey. You will have seen this type of slide in all the previous presentations that I delivered. Again, this one looks a little bit different because it's blue for the Commonality vaccine. And I just wanted to highlight one really, really important point before we continue, which is the dose. So 0.3 mils, and I know Nicola will give some really practical advice in terms of things you need to consider when moving between different vaccines in your pharmacy. But this one is a 0.3 mil dose. This is different than every other COVID-19 vaccine out there. So I just really want to hammer home. It's 0.3, which I'm sure you got that message now. In terms of a query that's coming in regularly is how do I know what vaccines I'm getting? The team of Vision who are supporting the HSE in this programme will phone your pharmacy and let you know the number of files you'll be getting in. That quantity, another key question that comes to me and has been coming over the last few days, is that quantity will come to you every 2 weeks, and you don't need to reserve doses for your second dose vaccine. That's another key difference between this and the Janssen, and this is a 2-dose vaccine schedule, so 28 days apart, and you will need to book in the second vaccine at the time of the first. So how does this arrive? I'm not going to go through the entire slide because a lot of this is covered in some of the further slides, but in terms of how it arrives it's been broken down by the national cold chain into smaller vials. The Janssen comes in a pack of 195 files, and no one is getting 195 files into their pharmacy. It's a very big box. That's what goes to the vaccination centres. So you get a broken down box into your pharmacy, and it will be over-labelled. So there are some information around some dates and expiry dates and use-by dates that I'll talk through. But in terms of a key point I have on the side and would be covered in all of your clinical learning you would have done on the HSE land, which has been superseded with the interim solution, is that this vaccine will arrive thawed, and so you don't need to re-thaw it. It already will be thawed when it arrives into your pharmacy, and that the transit time will be noted on the box, so you'll note that it hasn't exceeded 12 hours. So just in terms of today, this presentation is not to override any of your information that you've been given so far in any of your clinical learning or any of your learning on HSE land. This is pulling together all the bits of information that you've been given and hopefully making it really practical as to how to run this service in your pharmacy. So in the next slide, just in terms of this vaccine appointment, how would it be different than the Janssen? So first of all, you have to book in batches of 6. You should always get 5. Generally, you should get 6 doses from each file, and you may occasionally get 7. And Nicola will talk through that later on in the presentation. You will need a contingency list. These vaccines obviously are precious and need to be used appropriately. So you will have to have a contingency list for that additional draw or any no-shows that might turn up. One question that has come in terms of if people have a vaccination appointment booked elsewhere, it's really important that you tell them if they have logged on to HSE to register for a vaccine, if they get an appointment and have also registered with yourself, they need to let the HSE know that they're coming to your pharmacy, so they have to reply back to that text that they're not going to show up. You need to book appointments to match your delivery. So you will be given enough information prior to expecting your delivery of how many vaccines you will be receiving and the plan in. So when these vaccines leave, they have 31 days from when they leave the cold storage. So you will have approximately 30 days, give or take the transit time, to use these vaccines in your pharmacy. So you'll need to make sure that you use them in the time and they don't go unused. Same as before, patient needs to provide to wear a loose top, and you will need ID and the PPSN number. Very similar to the Janssen in that respect. The next slide I'm just going to talk you through is the patient cohort, which has probably caused the most amount of questions into us. So I have up here on the right-hand side of the screen that anyone who can register for a COVID-19 vaccine if you're 35 and over. So that's a current cohort that are being vaccinated in the vaccination clinic. And our vaccination programme will run along the national vaccination programme cohort. So as the HSE change that cohort and it moves down, so will the pharmacy vaccination age will move down likewise. So I have the link there on the right-hand side as to where you have it, but I'm sure there's plenty of news and media. You don't have to go far to realise when that number has dropped. So depending on the level of interest you have for your pharmacy, you may have quite a few people over that age of 35 looking for a vaccine, and you should be basing, if you have too much interest, on their age and their cohort or any additional risk factors. So do prioritise those who are of a higher age or in a higher cohort or have additional risk factors over 35 if you have a lot of interest in your pharmacy providing this service. So that's how you prioritise. There was another question that comes in that if you have if you have a person on the contingency list who is 34, can they be vaccinated? The vaccination programme is for 35 years and above, but no vaccine goes unused in this particular programme. So if you have someone and is the only person you can use in terms of contingency list for that last file or that extra drop, you can go down into the cohort below, which would be in the 30 to 35-year-old cohort. So you work down the cohort if you have an additional draw and you can't get a 35-year-old plus up into your pharmacy. Vaccination equipment looks very similar to the Janssen vaccination equipment. So all the consumables on the left-hand side of the screen, I think as you see it, are the same as you would have got for Janssen. And for those pharmacies who haven't provided Janssen, it's just all your consumables that we would have ensured through our discussions with the HSE were provided to you the way they would be provided to other vaccinators. The difference for this particular vaccine is you get additional needles and you also get an additional syringe. And this is for the dilution step. So there are a few bits of more consumables, and when we talk through the dilution step, and Nicola will talk through that in more detail, you'll understand which needles and how they all work. Again, all of this information is in the SOP template on our website, but it's just good to check off that you get all of these in your order from the HSE. So for those who haven't been provided the Janssen, your deliveries come in a few different batches, so you won't get everything at one time. So the consumables come in one batch, the leaflets come in another, and I've just pulled out on the bottom of the screen that the diluent, which is the sodium chloride, will come actually in with the vaccine delivery itself. So don't expect that to come in with the rest of the consumables. It comes in with the actual vaccine. So you get the same amount of diluent as you do vaccines. So that's just how that works. So it will probably come in 3 lots, and you will get then your information leaflets and your vaccine record cards and your patient information leaflets. I would have said this on the previous presentations, but I reiterate the message now. It is important that you use the most up-to-date information in terms of the patient information leaflet. So if it does get updated, make sure to destroy or get rid of any old patient information leaflets so that there's no risk in your pharmacy of giving out outdated information. We will of course let you know if there is updates, and there has been an update to the NIAC guidelines that went up live on the immunisation website on Friday, and we'll be detailing out the differences in that NIAC guidelines to the current ones would have been dated the 10th of June. So we'll keep you up to date as to when there's a change, but if there is a change in leaflets, make sure you do your bit and destroy all the outdated information in your pharmacy. So that's just one to watch. So just quickly, I wanted to touch on the SOP for this particular vaccine and how it's slightly different than the Janssen. Now, they're all obviously quite different, but I'm going to just look at 3 areas that are really quite different to the Janssen vaccine. We are on version 6 of our Commonality Vaccination SOP template for you to pull down and adapt for your pharmacy. So it's up there, and I will keep that updated as any guidance change. Again, just reiterating the point that unlike the flu program, guidance for this program does change, and it's not a one-stop shop in terms of doing your SOP and understanding every step. You will need to keep up to date with any changes, either in eligibility or if there's any changes in some of the clinical information. You'll need to keep up to date with this particular vaccine. The NIO is a wealth of resource in terms of that, but again, we will provide you with an update. I have on the right-hand side of the screen the Reconstitution from Appendix 4 of the HSE's operational guidelines. I've pulled this out as a separate standalone document that's now on our website. And when we talk about the dilution step in Nicola's section, we will be referring to this particular template. So as I mentioned, we're on version 6 at the moment, and that was updated of our SOP on the 21st of June. And how that changed to previous versions, if you printed it off, is a slight change to the inclusion of storage conditions of the unopened file. Fmd Authentication, we had in that you had to authenticate, but given that no one's receiving 190 files, it will be authenticated by the national cold chain before it reaches your pharmacy, so you don't need to authenticate it. And a requirement to record the date and time in the 24-hour clock format. That's just so it's standard across all vaccinators in the HSE programme. There's a link there provided for that SOP, and if you have any queries on any elements of that SOP, please come into us here, and we're more than happy to help sort them out. Just want to reiterate, at the moment, the immunisation NIO email address is down, so that they're still using the Gmail account, which I've put on the screen here. They've been very supportive in any queries we've had to date, and for any pharmacists who've had any queries on whether a product is suitable for someone, the immunisation office are a great resource. So just reiterating, don't include patient identifiers in any communication to the immunisation office, but they're more than happy in having in any clinical queries through that number. In terms of dose and eligibility, I think I've reiterated it was 0.3 mils, and it was a dose of two-dose regime, which is separated by 28 days. There are some exceptions in terms of when you can give it early and what would be considered a valid dose. You would have done that all in your training program. At the moment, it is licensed for use for 12 to 15 and anyone over 12 in the EMA for its conditional marketing authorization. However, just to call out, at the moment in Ireland, it's only been used for those of 16 years and older. On the right-hand side of the screen, I have the checklist for this vaccine. Again, you'll need to pull this off and ensure that you have the most up-to-date version of that when you're doing your patient consultation. So there's links of all of these documents on our website, which I'll talk through in a while, but just make sure, again, it looks very similar to the Janssen one. So they don't look that different. They both got yellow strips. So please make sure that when you're using you're doing a Pfizer vaccination service, you're using a Pfizer vaccination eligibility checklist. It sounds very basic, but in a busy pharmacy, it's really important that you keep everything separated for the two different vaccines. So I want to talk through the three different dates here. It's important when it comes to Alan's section on the HSE PharmaVax that you understand the difference between all of these and why you record them in the system. So expiry date is the expiry date if the product was kept in cold storage. So that's the expiry date that you see on the file. It isn't the expiry date that you'll work off. You'll work off the use before date, which is 31 days from when it leaves the cold storage. So that use before date won't be on the file. It is on the box, and Nicola will probably, I think, has an image in her presentation element as to what that looks like when it comes into your pharmacy. But that use before date will be put on by the national cold chain. So that use before date is obviously the day your date before you have to use it. You will then have a discard date and time, which is based on when you dilute the product, which is 6 hours. So the discard date and time you write on the vial yourself, but you don't record in the Pharma Facts system. That gets recorded on the sheet, which we showed in the previous slide, which is the Reconstitution sheet for that vaccine. So just in terms of expiry date and use before date and discard date and time, what will go into the Pharma Facts system, and Alan will talk you through how that goes in, is the expiry date, which you get from the file, and the use before date, which is on the pack. The expiry date is needed there for just in terms of if there is some kind of reaction that needs to be reported to the HPRA. It's important that we have the expiry date and the batch number of this product correct in the Pharma Facts system. So that's just the different dates. So that might cause confusion, so make sure that you're clear on which dates go where, and Alan will talk through those in a little while. Just want to talk through something that may have passed you by in the detailed operational guidance from the HSE, but I thought I'd just pull it out because it was quite a big document and you can often miss certain sentences, but just so we're clear, it says in the document, in the interest of safety and accountability, the pharmacist must personally carry out all the activities involved in reconstitution, drawing up and the administering of this vaccine. So in terms of the signature 1 and signature 2, you will have to be the signature 1 if you're the vaccinating pharmacist, and the signature 2 on this list will have to be a member of your staff or a second pharmacist if you have a second pharmacist in your shop. So that is the reconstitution that you need to do. So that's where your batch number, expiry date and use by date, as well as the dilution steps, get signed off in your pharmacy. It also states in the HSE operational guidance that a second check or double check of the dilution and preparation should be undertaken with a colleague, and you will need to keep those reconstitution records safe in your pharmacy. Just in terms of supporting documents, there are a fair few, and I'll talk through exactly where they are on the website, but I'll just go through them quickly now. So the template is on our website, as is the operational guide for this particular vaccine. The PIL, there is a link to the PIL, but again, this will be delivered with the vaccine. The excipients list is there for you to pull off, laminate, and keep in your consultation room. Again, make sure that's clearly distinguishable from your Janssen excipients list. The NIAC have just updated their guidelines, and actually the section on contraindications is a lot clearer now in the new guidelines. So that will really help in terms of some of those clinical queries. Your patient record cards, HSE leaflets, eligibility checklist, and your dilution step record. They're all available on our website, but again, the record cards, the leaflets will be provided by the HSE in their package that comes to your pharmacy. Reconciliation form and dilution step are available on our website to pull down. The reconciliation form is also available on the NIO website if you want to use that as well. The vaccine booking form is available. That's for anyone who didn't provide the Janssen vaccination form. That's a form that lets you collate all the information you need about a patient to enter into the Pharma Facts system prior to them coming for a vaccine. SMPC, the latest one's there. It probably will be updated at some stage in the next month, so do keep an eye on any updates we have on that. And of course, the updated NIAC guidelines are now on our website as well. So I'm going to pass over to Alan, who's just going to talk through the Pharma Facts element of this program for this particular vaccine.
Thanks, Claire. If you could just, actually what I'm going to do in this one is talk through a couple of screens in PharmaVax, but I'm not going to cover the whole system. We've done that in previous webinars, so those recordings are on our website, as well as a user guide for the PharmaVax system. It's on our website, and you would have received it in your health mail as well from the HSE about using the system. So if you've any issues with using that system, you can come back to that. The slides are gone a bit funny there, Claire. Just while Claire is sorting, oh no, here we are. So just back one, thank you. So what I'm going to do here is I'm going to cover recording the delivery into your pharmacy of the Comirnaty Pfizer BioNTech vaccine. It's slightly different. All 4 vaccines that are currently available are slightly different to each other in terms of what you're recording in the Pharma Facts system. So for this example here, you're going to select the Comirnaty from the drop-down. As I said, there's going to be 4 there in the drop-down because there's 4 on the market, in the Irish market at the moment. You'll put your batch number in there beside that. The MAH, the market authorization holder, will auto-populate because you're selecting that actual vaccine type. So that'll be populated for you in there. You're going to put in the expiry date here, which is on the vial itself, and then the use before date and time will be on the outer packaging. So that'll be on the carton that gets delivered in from the NCCS. So that's what you do when you're recording the actual vaccine itself. When you get a Comirnaty, you'll also get a diluent delivered with that too. So you need to record this in here. So you'll drop down and you'll select it there. I think there's only one option at the moment. You'll put in the batch number for that. The MAH again will auto-populate, and you'll have the expiry date to record there. So you need to record both of these because this is what you're using when you're recording the vaccination event against a client or a patient. Next slide, please. So again, I'm not going through the full screen here for recording the vaccination event against the patient. I'm just going to draw your attention to how this one is different. When you are recording the Comirnaty vaccine for a client, which is what's called a patient in the HSE PharmaVax system, you have to put in the diluent details. So first you record the vaccine itself. You're going to select the actual batch from the drop-down that you've recorded in your pharmacy, the dose that that patient is getting, and then the injection site. As I said, the diluent details will pop up, so this is something that you'll need to record. If you don't record both sets of information, you won't be able to save that record. So that's why you have to record the diluent information there as well. Next slide here. So I was saying we're not covering the whole HSE PharmaVax system. If you have not been set up on this system yet, I strongly advise that you get to do that as soon as possible. So you need to dig out the email that was sent to your health mail. If you didn't receive that email yet, because some of the questions in here are about receiving that email, what you should do is email in the first instance into ICT support at free.ie and the A2I hids.support HSE address. So both those email addresses there, you should email in just a query about getting your account set up. It's important to get it set up as soon as possible because if you're going to have any technical issues, it'll be at this early stage. We've split out the different kind of issues that people have experienced with the system here. Now there's 2 sets of numbers and email addresses, but they're just split out into the issue type that you might have. I want to draw your attention to the PSI details. So sometimes when a pharmacy connects to the system, your PSI details are in there as part of your pharmacy record. If that's incorrect, you should email in or ring in to get that updated. Now, I know there's a delay in that happening, so there could be a 1 or 2 day delay in those details being updated. That won't stop you from using the system, so you should continue to use it for your vaccinations and recording the events because it's taken a couple of days for those PSI details to get updated. We're going to show you where we have all this information on our website later in the presentation. We have supports up there for the HSE PharmaVax system in the form of a user's guide. We have this information in there for your support, and we also have a video up there as well. I think that's mine, Claire. Okay, thank you.
Thanks, Alan. The useful links, I've just put up the ones that I thought would be most relevant to you, but as Alan said, I'm going to talk through the screenshot there in a little minute in terms of what support materials we have available. And before I do that, I just want to introduce Nicola Cantwell. Nicola has been currently working in the Carlow Vaccination Centre and has great experience from a practical sense of this vaccine. I hope to get that practical experience myself in the next little while when we get out vaccinating in a community pharmacy, but don't have it at present, so I thought it'd be good to get some inside information that would be really useful for you and give you confidence in providing this vaccination programme. So over to you, Nicola.
Hi Claire, hi everybody. Hopefully you can hear me. I've been having internet trouble all day. So I'm just before we start, I'm not a vaccinator. I don't do needles unless I absolutely have to. So I've been involved in the vaccination stewardship in the vaccination centre down in IT Carlow, and this is my team here. So I work with a team of technicians and pharmacists, and we spend our day filling the syringes and drawing the doses. So if you want to move on, Claire. So basically our process is slightly different. I think that's something to be aware of. I know when I've been talking to people and sharing our resources, the guidance in the centres is slightly different to that in pharmacies because we fall under the HSE remit. Excuse me. So at the moment we've drawn up, I think it's 30,000 syringes since April across. We've done AstraZeneca, Janssen and Pfizer. We haven't done any Moderna. So this is just a picture of how we work. So you can see we keep our saline with us until we're finished with our vial, just in case we need to check back over it. And we do a lot of the pre-filled syringes. So you can see we have our saline in the middle picture there. Our saline is drawn up and ready to go as soon as we dilute the vials. And then we label our syringes and leave them in the trays ready to go. So the big thing I think you really need to be aware of is that the guidance is continuously evolving. Since we started in April, the shelf life of the drawn up syringes for Pfizer has changed from 90 minutes to 6 hours, and Janssen has gone from 90 minutes to 3 hours. So you really need to keep an eye on the guidance the whole time. It's amazing. I think we're on version 17 of some of the sheets that have been sent out to us. So it's very important. Almost every week you need to check to make sure nothing has changed in relation to community pharmacy. And a good place to look for that is the vaccination bulletin that's sent out by the HSE. They do it almost every week. So just to keep an eye on that on the HSE website. So if you want to move on. So this is this is just a picture here around the dilution. There's a lot of people kind of curious about the dilution. So the big thing really with this is you use the green needles to insert to put the sodium chloride in. And the way it works, a lot of talk about the 90-degree angle. So what you do with that is when you're in, and I'm sure you all know this already, when you're putting in the saline into the Visor vial, to make sure that you use the needle has the bevel side up, so almost like the eye of the needle is facing towards you. You push it slightly into the center part of the vial and straighten up, and you go in then at 90 degrees. It's important to put the sodium chloride in slowly. Now you don't have to, drop it in, but don't shoot it in either. The risk if you put it in too quickly is that you make the vaccine frothy, and it's very difficult to get 6 or 7 doses out of the vial if you have too many bubbles inside it. So you put it in slowly, and once you've put it in, then the syringe itself will almost shoot back up to the 1.8 mils. So almost the full amount of air comes back out without you having to do anything with it at all. Once you've got it to the 1.8 mils, then the easiest thing to do is actually remove this vial from the needle, and that stops you getting a squirt of air or a squirt of liquid out of it. So once you've that done, then it's a question of you invert it 10 times, wipe it off, and then you can start drawing up your doses. The other thing we came across a few times was if you get distracted or something happens and you forget to draw that 1.8 mils of air out of the vial, when you go to take your doses out, you'll put the blue needle or the blue syringe in, and it'll shoot back up, and you'll get a certain amount of air out that way. So what you do is you check that syringe, see how much air has come out, use a second blue needle and syringe to take the remainder of the air out. So you can withdraw the 1.8 mils after you've taken out the green needle, even if you forget. So it's not something that you need to worry about too much, if you do happen to make a mistake. And we found at the beginning, a few of us did forget to take it out. Once you got into the swing of it then and you had it in your steps, it works very well. And one of the things we started doing to remind people to take the air out is to leave the green syringe in the kidney dish until you have done the final inversion, and you'll know just by looking at the syringe that you've drawn out the 1.8 mils. So that was something that we found helpful. If you want to move on then. Okay, so this was the drawing up of the doses. So again, the same idea. You clean the top of it between each drawing. It takes a couple of seconds for the alcohol swab to dry off. Once you've cleaned it, then one of the things that's very important we found is to tighten those syringes before you put them in, because different times we found that the needles or the syringes, the needles popped off the top of the syringe. So make sure you tighten it before you draw your dose. And again, just before you give the patient their dose, make sure you tighten the top of it as well too, just to make sure it doesn't accidentally pop off. Once you put in the needle, and again, it's the same idea, you pierce the top of the core in the middle circle and then straighten it up to 90 mils. You draw out your 0.3 mils, and you'll find when you do that, you'll see that it starts to, the vacuum will almost cause the syringe to go back up into the plunger, back up into the syringe. So you just want to make sure you hold that at the 0.3 mils, get your second check, and again then take the vial off of the needle, ready to give to your patient. One of the things that some people were talking about was about, squirting a puff of air or 0.3 mils of air into the vial before you use it. That's correct from a physics point of view, but in the vaccination center we were told not to do that, because the risk is that if you don't get the amount of air correctly right, when you pull your needle out, you'll get a squirt of liquid out. And even if it's only a couple of drops after every syringe that goes in could very easily add up to 0.3 mils. So we don't put any air into the bottle, even though physics would tell you that it would. From a practical point of view, it doesn't work as well as just holding the syringe at the 0.3 mil, taking it out, and then giving your patient your dose. Get your second check of the 0.3 mil dose before you give it to your patient. And again, it's a new syringe every time you draw the vaccine, and you shouldn't need to change the needle between the vial or the syringe, between the vial and the patient, unless the needle is contaminated or damaged. What we found with the needles and syringes that we were getting from the HSE, you need to check them before you use them, because sometimes you'll see them in the pack and the needle will be bent, or it'll be slightly off center, or it won't look right. So I would definitely say check all of the needles and syringes before you start drawing up the vials. It's easier to discard them before you've got a dose in it. And we found maybe out of every 1,000 syringes that we would do, you could get 50 or 60 that weren't suitable for use. So just double check them before you start drawing up your doses as well. Next slide, please. And again, this was the step that's here. In the interest of safety and accountability, the pharmacist must personally carry out all of the activities involved in reconstitution, drawing up and administering the vaccine. It doesn't specify who has to do the second check, so you can use another technician, or a pharmacist colleague can do that. We have a different dispensation in the vaccination centre. We have pharmacist technicians, student technicians and student pharmacists can all do the drawing up, because we have so many double checks in the process. But again, get into the habit of going down through the vaccine reconstitution steps every time you do it. It's amazing how easy it is to forget to do a particular step. And one of the things that's really important is to stand still when you're turning the bottle up and down. I found people when we were working, they were walking around. You could see them starting to walk around the pharmacy, counting 1, 2 as they were turning. The problem with that is if it slips out of your hand and it falls on the ground, it's no use to anybody, because the proteins in the vial are so delicate. So I probably sounded like a broken record at the beginning of our vaccination centre, but I made sure that everybody stood over the counter, and we actually put that roll of white tissue that is listed in your sundries, we actually have that on the counter. So if you did happen to let the vial slip out of your hand, if it's over it's over the counter, it has a soft landing. If it's only a small fall and it lands on its side, it's fine, but if you drop it on the floor, it's no use. So stand still when you're inverting the vial. Check it to make sure there's no particulates in the vial, to make sure nothing has caused a problem. When you've put in your sodium chloride and you've inverted it 10 times, check again for any particulate matter as well too. That's what you'll often hear people talking about coring, and that's what coring is, when a little piece of the cap comes down into the vial, and you can see that sometimes just floating around. If you have that, you can't use the vial. But just as I said, you need to kind of keep stepping it out over and over again, because it's so easy. And even still, sometimes you'll see people and they might get distracted for a second, and they'll forget to rotate it 10 times, and you have to go back to the step and go rotate it, tick it, and move on again every time. So next slide. Oh yeah, this was my bit, stand still over inverting the vial. This picture here, if you have a look at it there, see the label at the very back behind where it says the Comirnaty, the line at the sticker at the front of the box is the manufacturer sticker, and the sticker at the back then is what United Drug put onto the box. So that's where the shelf life, the expiry date after it's been thawed, will be on the box there. So we scan it in our place. So generally what we do is, rather than taking the boxes in and out of the fridge every time we need them, we stick that sticker to our computer, and we have it on the computer, so we can just type it in every time. So it saves us having to open the fridge while we're inputting the information on the computer system. So that might be useful to you. Is I know you'll be getting the smaller boxes with 12 in them. So what we found handy when we get the 12 boxes is we write down that information, or we take a picture of that information and stick it on the side of the computer. It just reduces the amount of time that you're opening and closing the syringes, or the fridges, I should say. If you do happen to get the 195 box, it's also a good idea. We have a sticker on the top, and we write down how many we take out, because one of the requirements of the vaccination service is that you count the number of vials you have in the pharmacy twice a day, morning and evening. Now that shouldn't be too bad. In community pharmacy, we have, I think at the moment, there's 1,500 vials of Pfizer in our fridge in Carlow at the moment. So you just need to, we're trying to sort of save ourselves time whenever we can. The other thing, and Claire touched on it, 99% of the time you get 6 doses out of the Pfizer. We don't count 7 ever. If we get the 7, it's a bonus. But when we're booking our appointments, it's always booked based on 6 coming out of each vial. The thing to watch out for is occasionally you will get a 5, and that actually can throw you sometimes, because you're sort of flying along with your 6s, and then all of a sudden you get a 5. If you do get it, there's nothing you can do about it. You know, you've got it, you just have to sort of figure out how to manage the patient that's not coming in. But just to be aware, it's not as a result of an error or anything that you've made. It just seems to be that not all the vials are filled as well as you could think. So just, I suppose, to be aware of that, it's 99% of the time it's 6s, 7s are a bonus, and don't worry if you get an odd 5. You know, it's just the luck of the draw. Do you want to move on? Yeah, these were just kind of hints and tips we came across as well too. I suppose set up everything ahead of time, pre-writing the vaccination record cards. You know, if you've got 6 people coming in, it's easy enough, you know, for a dose. It's handy enough to have all the information on. The Pfizer one doesn't come with the little stickers that the Janssen come with, so you have to write the batch number manually on yourself. Excuse me. Do your double checks all of the time. I can't emphasize that enough. Some places use gloves for the vaccination. We generally 99% of the staff in the vaccination centres do use gloves. I don't. I find them very difficult to work with, so I prefer the gel. So I use gel the whole time. And you need to change gloves for each patient, which I know you all know anyway. Keep watching for the SOP updates. They're changing all the time. We sort of seem to have a change every kind of 2 or 3 weeks or so. So you need to watch out for that as well. A couple of other things I thought of as I was listening to it as well too. The saline that you're using, it's tempting to sort of use all of the saline for all, you know, use one vial of saline to do the box of vials. The SOP is quite clear. It's 1 vial, 1 amp or 1 vial of saline per vial of vaccine. So make sure you discard it when you've given out your 6 doses. Throw out the saline, then you're finished with it. What else was there that I came across? Oh yeah, don't throw away the box of Pfizer vials, you know, the empty box until you're 100% sure you're finished it, because you'll always find that the minute you've shredded the box and thrown it in the bin is when you'll need the information, the batch information that's on it. We were also told in the vaccination centres as well to use a permanent marker to score out the vaccination information, you know, the batch number and the expiry date on the vials, and make sure that they're unusable if anybody happened to get their hands on a used vial. Apparently there's quite a big demand on the black market for those. So one of our steps at the end of the day when we're doing our vial reconciliation is to use a permanent marker to cross out all of the information on both the vials that the vaccines came in, but also the batch information that's on the cardboard box as well, so they can't be reused by anybody. You want to move on, Claire? I think we're nearly finished, are we? Yeah. This one as well too. Again, I feel like this is sort of rocket science, and I feel not rocket science, I should say, and I feel like I'm preaching to the choir because you all know this, but I suppose the potential is that you will have two types of vaccine. I wouldn't actually be as worried about the two types of vaccine. It's the different batch numbers I would be more concerned about. So we have our, we separate our vaccines by batches and also by brands. Now I have 2 fridges in the vaccination centre, so it's much easier for me. So generally we only have two batches on the premises. So I have sort of half of each vaccine in each fridge and the batch is separated, but do try and clear it away as best you can. Make sure if you do have different batches that all the vaccinating pharmacists are aware of that. If we happen to be changing vaccines, so say if you're doing Pfizer in the morning and you might be switching to Janssen in the afternoon, we do a safety pause or a team huddle, whatever fancy term you want to call it. Basically, it's just to stop and catch your breath. And we actually make a physical, we get rid of everything. We put all of the Pfizer information away in a box on the shelves. We go for a hunt around, make sure there's no leaflets, no vaccination cards, no anything lying around. So everything that could possibly be related to Pfizer only is put away. Then we put the Janssen one out and we start from scratch again. One of the things we do as well, and anyone who knows me knows I'm a big fan of laminated cards and visual aids. We have the information around doing each particular vaccine laminated, and we physically stick it up on the wall when we change. So if we're changing from Pfizer, we'll take down the Pfizer notes and we'll put the Janssen notes back up again. So just to be careful around that as well too. It's very easy, you know, it's very easy to sort of pick up the wrong vaccination card and fill it out, and it causes all sorts of confusion when the patient comes back for their second dose. So that pause is really good. And I would even, we do now down in Carlow, what we do is we have the safety pause, all the vaccinators have to stop, but I actually get the pharmacy team to go outside and get, numbers are different, but it's just walk away from the job you're doing and then walk back in and start all over again. So I think that's it then, if you want to move on to the next slide.
I think that's it, Nicola. I actually had one question. I know we talked about it prior to preparing this, and we talked about the top of this file, and I think you said it's quite small, so to be quite careful, was it, in terms of the top of the Pfizer vaccine file?
Yeah, if you look at when I thought I had a picture, but it's disappeared. When you look at the top of the Pfizer vial, you'll see a round, sort of slightly raised circle in the center. You can't really see it there. I think that picture got lost somewhere. But anyway, when you look at it, there's a circle in the inside. So you'll see there's the metal cap, there's a little bit of rubber, and there's a slightly raised circle. And inside that raised circle is where you insert the needles. So what you want to do in order to avoid coring, and coring is said to is where the little bits come into it, is you literally just, and it's one of the technicians actually described it very well, as she said, you poke the pointy bit of the needle with the beveled bit up into the center of that circle, straighten it up to 90 degrees and then push it in, and that's how you draw it out, and that's the vaccine out, and that's how you avoid the coring. If you're unlucky enough to get the coring, and that's where you have to check the vial every time you've had a needle in it, make sure there's no little bits in it. If you've got, say, sort of 2 or 3 doses out and then you get coring, check the doses, and if there's no coring in those doses, they're fine to use. But if coring happens at the first dose or straight after you've diluted, then you can't use that vial at all.
Great. Thank you, Nicola, for your information. I'd say we probably do have some questions. If you could hold on and answer some of the questions that might be more practical in nature, if you don't mind. What I might do now is just try and share my screen to show the people, everyone who's watching, the information on our website. Alan, can you see that screen?
That's fine, yeah.
Yeah, so we've built 3 different hubs on the website, and I just want to help yourselves as to where to get the information. So I'll start with this vaccine, which is the Comirnaty Pfizer vaccine, and on our website, it'll be found in the resources section. You go down to the top one there under coronavirus, and it's the Comirnaty hub. And on that hub, I have some of the material that we mentioned there, which was the time to leave ticket and appointment booking. That's your 15 minutes or 30 minutes depending. We have the vaccine specific resources there, the up-to-date ones, but again, some of these will be sent in. The stuff that you won't be sent in, which will be useful, is the reconciliation form and the dilution guide. So that's the appendix 4 from the operational guidance. I've just pulled that separately for you to be able to access and print off as you need it. The updated NIAC guidelines that I mentioned are there along with the HSE operational guides. And that covers off things like your cohorts, etc. I know there's been quite a few questions in the box about cohorts, which I'll cover in a minute. Then Reconstitution and link to the HSE guidance documents. So that's what Nicola would have referred to as there's a significant number of changes in them over time. The other bit I'll draw your attention to for this is just the SOP and the vaccination policies and the excipients list. We've included some useful links, which are to other bits within the website, and also useful contact queries. So I have the immunisation NIO's Gmail account email address there. Pharmacy vaccines, that's where you have a query on the delivery, goes to this particular vaccine. Pharmacy response, a query on the actual vaccination programme for the HSE, and then another link to the immunisation.ie website. The Janssen vaccine, which just mirrors that one, but anyone who wants queries on the Janssen vaccine, one difference I have on this one is I have FAQs. I will be adding an FAQ one to the Commonality hub tomorrow to match the questions that we get asked tonight. So we will update that tomorrow with your with an FAQ section as well. Want to draw your attention to the HSE Pharma Facts. I know there's been some issues, and especially if you haven't vaccinated in the part of the Janssen, this will be a very valuable resource. There is a good support guide and a user guide, which I think most pharmacists have found quite useful. Our previous presentation that we would have delivered, and then there is a query as to who you support or who you go to with what issues. So mainly, and I think Alan touched on it, where we seem to see the issues, the Pharma Facts is getting people set up initially. Once they get using the system, there doesn't seem to be that many. So that's that. What I might do is just go back to the presentation, and some of your colleagues were sending in queries to me prior to running this event. So I'm going to cover off the queries that we were sent in to date, and then Alan, you might ask either myself or Nicola if there's queries there that I haven't covered, if you don't mind. And then just checking on time, we're okay. So the first question I got asked was, can we vaccinate pregnant women and between 14 and 36 weeks in the pharmacy? As per the NIAC guidelines, they should be getting their vaccines through their obstetric care. So you should not need to vaccinate a pregnant person, they should be getting it through the obstetric caregivers. So that probably should not arise in your pharmacy, and if it does, you should refer those people back to the people managing their obstetric care. How many Pfizer vaccines will be sent to my pharmacy and how often? You will be informed of how many you're receiving, and that will be on a 2-week basis. There is a question I saw coming into the question box, will we get more? At the moment, the HSE are allocating out the allotment for pharmacy as fairly as possible based on geographical area. But as vaccines become more plentiful or more available, the potential is for increase, but they will always send you the vaccine for the second doses. So you will get a standard set for the first couple of weeks, and if vaccine quantities increase in the country, there is potential to ask for more, and we will detail out how to ask for those extra vaccines after the first initial weeks through our FAQ question. I think this has come through quite a lot in the chat box. Can we give second Pfizer dose if they had the first Pfizer dose elsewhere? The simple answer for this is no, and there's several reasons for it. At the moment, the vaccination record in Pharma Facts isn't working, but that's due to be updated. There is a concern within the HSE because they're dealing with a lot of new systems, and the Pharma Facts system into the COVAX system, and then the vaccination passport or the certificate, I suppose is probably a better use of the term. There is a concern that if people get one dose somewhere and a second dose somewhere else, that certificate mightn't work for people, and that might be important when it comes to travelling. There also is concerned about wasted doses sitting in vaccination centres or in GPs, because when a GP is vaccinating a person, they get the same as pharmacy, they get the second dose for that vaccine. So that is a no at the moment, in that you're doing first doses and you will be doing second doses in the vaccination programme. Another query that came in, can we vaccinate a 34-year-old if we don't have any 35-year-olds on a contingency list? So the answer to that is you go next cohort on if you don't, but where possible, we're sticking to the HSE plan. So having talked to a lot of our members, I don't think you're going to have to worry about that. There seems to be great interest in all the pharmacies for the service, so I'm not even sure that will arise. But if it does, it's the same for all HSE vaccinations. You go to the cohort down, but we'll see if that actually happens, because there seems to be great interest out there for this particular vaccine from pharmacies. Reconciliation forms, is there a specific number of days prior to the next delivery that they need to fill them out? The HSE's view in that is a good rule of thumb is 3 days before your delivery. If you send that through, that's the ideal time. I know it did come in, it said, can we vaccinate, as a question, can we vaccinate anyone over the 35 to 45? Yes, you can vaccinate anyone 35 years and older. 35 years is people currently being called into the vaccination clinics. So yes, you can call anyone 35 years and older can avail a Pfizer vaccine. I saw a question coming in going, if I have someone over 50, do I have to give them Janssen or can I give them the choice? Ideally, they would take Janssen. It's a one-dose vaccine and it can only be used in those over 50 at the moment. So ideally, they should be given Janssen, but if you're running a Pfizer clinic, they can also get a Pfizer vaccine. So just manage carefully, obviously, because the best use of the vaccine in your pharmacy. A query came in about how will people be in my locality will be informed, and Kathy mentioned earlier on that it will be on the HSE website shortly, and we will have the details of the plan in terms of communication around pharmacy as part of the overall vaccination programme, and we will share that with our members as soon as we have it from the HSE. So they're the questions that came in prior to the time, Alan. Is there much else there coming in?
Yeah, there's a few more. I'm going to close off on a couple of the PharmaVax related ones first before I ask you some of the other questions. So one of the questions is related to the vaccination records. Do we need to keep a record in our dispensary system as well? So in the HSE PharmaVax system, that is your vaccination record. That's your electronic record. There's a reports tab there which you can print off at the end of every day or every vaccination day that you have. You can print that off and get that signed by the vaccination pharmacist in your pharmacy, and you can put your pharmacy stamp on that, and then that's your record. So that's been confirmed by the PSI. That can be your record, your daily audit report for vaccination records. So you don't need to keep a separate record in your PMR. The PharmaVax system is the electronic one, and you can print off a paper one. Another one, Claire touched on it there, is around the vaccination history. So the vaccination history is when the PharmaVax tells you the vaccination status of a client you're about to give a vaccination to. We don't have that just yet. We're expecting an update maybe Wednesday of this week. When you put in the client details, the system will then tell you if they've had a vaccination before. We couldn't give you a screenshot for that because we don't know what it looks like yet, but when we find out what that looks like, we'll let you know straight away. Questions are coming in, Claire. If a GP refers a patient up to a pharmacy, or if a GP practice has stopped vaccination, and they've given one doses or first doses to some patients, can you give those patients a second dose? I guess there are two different questions, and then there's GP referrals going up to pharmacies too.
Okay, yeah, so currently GPs are provided with that second vaccine for the second dose. So if they don't give it, then there's wasted vaccine sitting in a GP surgery. So very much like the same way we'll get a second dose vaccine for any first doses that we give out, the GPs will have that vaccine. So the HSE preference is that they get the vaccination at one centre, so that's at the GP surgery for the second vaccine. There is a way that a GP can refer back into the system, but it's not a referral to pharmacy, it's a referral back into the system. But that should be rare and isolated because they've committed to delivering second vaccines for anyone who's got a first vaccine. So that's that. Does that answer both those questions?
I think it does answer both those questions. Can a pharmacist pre-prepare the syringes ahead of a clinic?
I know in the HSE vaccination centres, and Nicola alluded to, they have different guidance. In our guidance and reflected in our SOP, the answer is no to that one. So you are meant to, as is stated in the SOP, draw up the vaccine just prior to administration and use the same needle. So that's in the template SOP that's currently available. I know it gets a little bit, it's something we're not used to because we're used to vaccines and the single dose vaccines for flu, but those who are using Janssen would be well familiar with that procedure at present. So at the moment, that's a no, that's not allowed.
Can I just come in on that there, Claire? Just to explain to people why we're able to do it. It comes down to the whole process of being able to resheath the needles, and that's technically that's illegal because everybody's supposed to be using the safety needle. So the reason we're allowed to do it is because of Colin Henry, who you might see popping up on the news every so often from the HSE. He signed off to allow the vaccination centres resheath the needles. So what we tend to do is we draw our dose and then we scoop up. You've probably seen the one-handed scoop where you scoop up the cap of the needle and recap it. So that's the only reason that we're allowed to do it. It would make sense for pharmacy to do it, but when I double checked the guidance, it came back to say that he was very specific. It's vaccination centres only, and the GPs weren't given the go-ahead to draw up the pre-filled syringes either.
Thanks, Nicola. That's great. Thank you for that insight. It's useful to get your experience on that front. Is there any other questions?
A couple of questions. When should pharmacies expect their first delivery of the Pfizer?
Most will have had a phone call from the Vision team to date. If you haven't, they're arriving in this week and next. So if they haven't contacted you and you have received confirmation that you're part of the selected pharmacies, the HSEs selected, you should receive a phone call or some communication relatively quickly, I'd say in the next day or two, and they'll tell you the doses. So the doses range for the number of vials range from 6 to 12, depending how many other pharmacies in your area are also vaccinating with this Pfizer vaccine. So that's at present.
Some specific ones here with a customer asking how soon after a cesarean section can she receive a Pfizer vaccine?
That's a clinical question, and I would refer you on to the clinical guidelines. But there is some great guidelines, and on the NIO it does go into a lot of those different cohorts of people. Again, if you can't find the answer there, the NIO team are excellent at answering those questions. So I don't want to answer a clinical question, but we do know people who will answer that clinical question for you. So don't be worried about getting an answer. We'll get an answer for you on that query.
I'm just glancing through here to see, so there's lots of similar kind of questions. Claire, if you want to just have a look, can you see them as well?
I think there's a lot around the first and second vaccine. I think there was a question that came in terms of adrenaline pens and not being available. I hadn't heard that. The person who put that in might let me know, did they check when they'd be available and whether I need to follow up on that query. It's the first time I saw that query coming in, and I will check with both wholesalers and get some information. And you will need the adrenaline before you provide the service, so I will get guidance in terms of that if there is an issue in terms of availability of that product at the moment.
Oh, Claire, sorry to interrupt you. That was something else. Yeah, that was something else that popped into my head there. The GPs we have working with us in the centres insist that if you've got a patient with a known allergy, that the vaccinator brings the adrenaline pen into the room with them. Now, I don't know whether you would have them in the consultation with the pharmacy, but in a pharmacy, but he insists that if it's somebody with an allergy of something that might be significant, that they have to stay for the 30 minutes, but that you have the pen in the room with you on the off chance that you need it as well, I just crossed my mind that might be useful for people as well.
Great, thanks Nicola, that's really useful. Yeah, it's in our SOP that they bring it with them, so they have to carry the files around. And actually, I think you mentioned earlier on in terms of the permanent marker, that's again the same, it's the same in community pharmacy. So there's a lot of similarities between both services, and I think it would be great to see this one up and going, because there'll be a big demand for this particular service in the localities that have been chosen. Given that it's 2 minutes past 8, we might wrap it there. I will keep all the questions. I'll add them to the FAQ, and that section in the website that I showed will have the updated FAQs, but keep coming in with those queries to us if you have them over the next day or two. I know most queries start in the week 1 of providing the service, so it will be it'll be probably a busy time over the next few days in terms of queries. So please look at the website and check for updated guidance going in there. Nicola, thank you very much for coming and giving your advice today. Thank you to Kathy as well for coming along and showing your face and telling us all how the Janssen vaccination progress is progressing out there in community pharmacy. Alan, thanks as always for your technical support and support in terms of the Pharma Facts system. If there are queries over the next little days, just pick up the phone, send emails to us. We won't be able to answer every query straight away, but we will commit to trying to get the answers out to you as soon as possible. I see quite a few queries over doses and second doses, so I'll include all of that information in our FAQs. Thanks everyone, thanks again.